Do you know that? The renal artery gives 5 segmental branches, 4 from its anterior division, and 1 from its posterior division. The segments are apical, upper, middle, and lower on anterior aspect, and this is posterior division. This is anterior branch of renal artery. This is renal artery. This is posterior branch of renal artery. Now let's discuss the blood supply of kidney. Renal artery arises directly from abdominal aorta and enters the kidney through the hilus. While passing through renal sinus, the renal artery divides into many segmental arteries. Segmental artery subdivides into interlobar arteries. Interlobar artery passes in between the medullary pyramids. At the base of the pyramid, it turns and runs parallel to the base of pyramid, forming arcuate artery. Each arcuate artery gives rise to interlobular arteries. Interlobular arteries run through the renal cortex, perpendicular to arcuate artery. From each interlobular artery, numerous afferent arterioles arise. Afferent arteriole enters the Bowman capsule and forms glomerular capillary tuft. After entering the Bowman capsule, the afferent arteriole divides into 4 or 5 large capillaries. Each large capillary divides into small glomerular capillaries, which form the loops, and the capillary loops unite to form the efferent arteriole, which leaves the Bowman capsule. Efferent arterioles form a second capillary network called peritubular capillaries, which surround the tubular portions of the nephrons. Thus, the renal circulation forms a portal system by the presence of 2 sets of capillaries, namely glomerular capillaries and peritubular capillaries. Peritubular capillaries are found around the tubular portion of cortical nephrons only. The tubular portion of juxtamedullary nephrons is supplied by some specialized capillaries called vasa recta. These capillaries are straight blood vessels, hence the name vasa recta. Vasa recta arise directly from the efferent arteriole of the juxtamedullary nephrons and run parallel to the renal tubule into the medulla and ascend up towards the cortex. Peritubular capillaries and vasa recta drain into the venous system. Venous system starts with peritubular venules and continues as intralobular veins, arcuate veins, interlobar veins, segmental veins, and finally, the renal vein. Renal vein leaves the kidney through the hilus and joins inferior vena cava. Now let's discuss the lymphatic drainage. The lymphatics of the kidney drain into the lateral aortic nodes located at the level of origin of the renal arteries, L2. Now let's discuss the arrangement of the arteries in the kidney. This is fibrous capsule of kidney. This is arcuate artery. These are interlobular arteries. This is glomerulus. This is afferent arteriole. So, this was all about this section. In our next section, we will talk about the layers to be reflected one by one in exposing the kidney from behind.
Explore our extensive library of over 1,800 video lectures to learn about a wide range of topics. Only on sqadia.com.